goal right now is to talk to you about manual therapy. In speech pathology world, it seems that there's sometimes a little bit of confusion about what types of manual therapy are available to us as clinicians. So I'd like to navigate manual therapy and share with you a personal website that I have been working on for resources for clinicians and talk about each of the courses that, to my knowledge, are currently available on sort of a recurring basis for you to consider. So, the first course that I kind of want to talk you through is I want you thinking about the idea of what does it look like in terms of my personal goals. You need to know what you're trying to achieve before you decide what specific course you're going to take. So we've created this website on laurenmeffin.com. If you go here and you go to education, resources for the therapist, let's start off with lymphedema. Lymphedema is a side effect that patients experience after head and neck cancer. There are manual techniques to address lymphedema. There are manual techniques to address radiation-associated dysphagia. There are manual techniques to address trismus intervention. So each of these diagnoses has its own tier, and we have created a framework to be able to help you navigate when you should be selecting what type of therapy to do for your patient. But first, I want to go through the courses. Okay, so right now there are 4 lymphedema head and neck courses that I am familiar with. The first one, in full disclosure, I teach for Norton, and this is a 20-hour course across 2.5 days, a Friday, Saturday, and a half-day Sunday, in which it is hands-on, in-person only. It is not offered online. It is offered at different locations throughout the country. I believe that we have 3 remaining offerings this year. In 2025, I will be at the May and I will be at the December. My fabulous colleague Lori will be teaching the August in California. So if you're looking to learn manual therapy techniques specific to lymphedema, which is going to be a lighter tactile approach, then that's a great course for you. If traveling is not an option for you and you want to begin to learn your learning online, I have heard fabulous things about Heidi Miranda Walsh's course. She is considered sort of our first head and neck guru in the world, right behind Brad Smith, who is a mentor of mine, who I love with all my heart. This course, Through Close Training, is an online course. The challenge is there's no hands-on tactile approach. Manual lymph drainage, you need to know how deep to go, how to touch. You need to know what direction. But I've heard great things about this if online is your starting point, because each one of us starts somewhere. The ACOLS lymphatic study course, this particular course I took about 5 years ago, and this is a 2-day course. This course is across 14 hours. And I am a bigger fan of the 2.5-day course, just to be honest, but I'm also very biased in full disclosure. I teach it. So I think that extra half day helps with compression, elastic taping, and the Norton course, we're able to cover that. And then I'd like for you to review and consider a course now offered by Chow. And that course is a lymphedema management of the head and neck. It ranges about 11 to 13 hours. And that particular course right now is offered online. They do have an in-person course with an instructor. And so I'd encourage you to look through when those in-person courses are being offered. So from a lymphedema management standpoint, there are your options for head and neck. Now, I also love, I'm curious, is Shelley Atlanta? Let me stop my share for 2 seconds while I search for her course. So I want you to consider, a couple of options. Okay, I do not see. I have a colleague that I work with who at one point was offering courses, but I wanted to make sure that I highlighted hers if it still was here. Her education. Okay, let me go ahead and share screen again. Her education is through LymphEd, and Shelly DeCecco is a physical therapist who offers online courses. If we kind of pop over here in terms of 2025 and 2026 courses, she encourages you to go ahead and email her. And then she does offer some advanced trainings related to the head and neck. This one is going to be 4 hours of a home program and then 2 days on site. I love Shelly. I don't know much about the course, but I absolutely love her. So, but again, I'm biased to me. Just a heads up for lymphedema. Now let's talk about manual therapy with myofascial techniques, stretching, and working with patients who have diagnoses that are not specific to lymphedema, but they are specific to fibrosis or other areas of voice concerns. I've taken Walt Fritz's course. It's fantastic. Your manual therapy. Here, you're going to walk away with knowledge of how to treat voice and swallowing related disorders and adding manual therapy to those patients. So, if you are a general speech pathologist who is seeing a large variety of patients and not niched down yet, I find this course to be fantastic for sort of that broad level outpatient setting. I work in the outpatient setting and I try to niche in head and neck cancer in the outpatient setting, but the reality is I see a little bit of all adult diagnoses at my private practice. So next one. All right, we've got our manual courses here for Walt Fritz. Now I want you to also consider a second manual course, and that manual course is going to be Chow. I've taken this course about 10 years ago with John Kelly. It's awesome. These are manual techniques that are going to help specifically with dysphagia management. John Kelly and Walt Fritz are both physical therapists. This particular course is going to teach you some additional stretching. It's going to teach you postural related. It's going to talk about the mechanics of the TMJ, soft tissue mobilization. It's a great course. But the focus here is on swallowing and specifically swallowing related disorders. Now, the other course I want to talk about from a manual component, if you are trying to address internal edema manual therapy, this particular group therapy learning network is with Shelly Ryan. That's her, physical therapist, and Joy Hess, a speech pathologist. They both are trained and well-versed in lymphedema of the head and neck. However, this seminar focuses on participants leaving with some manual techniques to address internal edema that is up and coming and still being studied by many of us. I've heard wonderful things about this course, and I think it is fantastic that we have one course to specifically help us guide how do we help internal edema. And that's a side effect of our patients following radiation therapy that can last for years. So when you decide, I want to take a manual course is a broad term. I need you to be able to sit down with a piece of paper and go, here's what I'm trying to identify. Here's my goals as a speech pathologist. Here's the patients that I'm helping. So what are you trying to accomplish in which manual course do you take? I've been a speech pathologist 19 years. I've taken a ton of manual courses. I walk away with pieces of information from every single one that helps me to create a huge toolbox that I can pull from based on my patient's diagnosis. Okay, so at Head and Neck Rehab, we have we are creating online portals for courses that will be available based on your diagnosis. So if you are hoping to help a radiation-associated trismus patient, the manual techniques that you will learn in this course will be manual techniques that specifically help amplification, resistance, and kinetics of the jaw. That is a course that I teach. The other thing I need you to consider, we are going to host in the summertime a course that will incorporate many modalities. Some of those modalities are going to be specific to head and neck cancer patient because manual therapy is one component to help your patient, but we need tools in our toolbox. So we need to be able to understand, well, okay, what is the purpose of my jade roller? What is the purpose of elastic taping? How do I use elastic taping to help my patient? What is the purpose of DISOM? What about cupping? What role does that play? So, in our course in 2025 in the summer, we are going to address those modalities to be able to help you build your toolbox of the head and neck cancer patient. And that's specific to head and neck cancer. If you want to learn more about other offerings or you have suggestions for us of what you wish was created, feel free to email me. I will be happy to listen to you and utilizing, like, well, what about Lauren? I've been a speech pathologist. I think that it's important that we understand respiratory muscle strength training. We understand bolus loading. We understand that each diagnosis has a series of evidence-based practice, and our patient's diagnosis falls within that series. So you need to really be able to start to differentiate what is your goal with that patient because speech pathology is individualized care. Our framework allows you, with wildflower therapy framework, allows you to start to piece that at the level of diagnosis. What's my treatment options? The level of treatment, what are my modalities and my side effects? And then at the level of rehabilitation, what are my evidence-based planning that I can offer my patient? Okay, I hope this is helpful to you guys for deciding what is a manual course, what are manual options for the courses, because I know that manual therapy can make a huge difference in your patients' lives. It can offer alleviating pain, it can offer improvements in their overall range of motion, improve circulatory flow. Manual therapy is beautiful. It's just a piece of what we do.